So I'm going to share a quote, and I want you to think about who said it, all right? And I'm going to give it some drama, so here we go. The elderly will once again walk freely and safely in the streets of the city. The squares will be full of children playing without fear or worry. It may seem impossible, but it is not. So who do you think said it? And I'll narrow it down. I'll give you two choices. Was that the voice of Governor Andrew Cuomo or the biblical prophet Zechariah? It's surprising. I think it could kind of go either way, and we wouldn't usually think it'd be so hard to tell. Those two men are not exactly quite alike. You've probably guessed, since I am the rabbi, that those are the words of the prophet Zechariah. I had really never thought much about that biblical passage until this year, when it seemed like Zechariah was speaking directly to us. Elderly will be safe on the streets, and children will once again go out and play freely. It sounds like he was giving us hope for this moment of our pandemic. But he wasn't. Zechariah was speaking to the exiled Israelites after the destruction of Jerusalem 2,500 years ago. I've been thinking a lot about those exiled Israelites. Many of you know that my love of history is not academic. For the Jewish people, few events can be called unprecedented, and that enables our history to serve each and every generation as a reservoir of strength in our present. And what is this moment that we are living through, if not a form of mass exile? So let's get back to those exiled Israelites and let's ask ourselves, who helped them survive their terrible ordeal? It was the biblical prophets like Zechariah. Now, these prophets were not all alike. Some were grumpy, some were poetic, some were fiery, some were just downright bizarre. As far as I know, none of them were sneezy or sleepy. But there is something common to all of them that may be of help to us as we face our exile. They share the prophetic perspective. When my wife heard me say that, she begged me to find a different phrase that would be easier to say. Prophetic perspective is going to be tough. You can count how many times I get it right. You can try it yourself at home. Say prophetic perspective. Now try that 5 times in a row. Okay, prophetic perspective. What is it now that we know how to say it? Prophetic perspective holds together two opposing outlooks. Heartbreak over the moral failure of the past, alongside the conviction that we are capable of more. Let's think of those exiles. They longed for the world that lay behind them, the world that they left. But the prophets wouldn't allow them to worship at the altar of an idealized past. With unflinching gaze and an unrelenting bluntness, they pointed at the moral failures of Jerusalem before it was destroyed. They knew that when the time came to rebuild, it would be wise for the people to remember their previous failures. Now, the prophets were not cruel. The goal as they did this was not to chastise the people, it was to awaken them to opportunity and to possibility. So as the Israelites sat exiled in Babylon, worrying about their future, the prophets buoyed them with visions of a world that they would return to create, not rooted in a lionized remembrance of yesterday, but in the promise of a prosperous and honeyed tomorrow. It was this outlook that sustained our people in their exile. And in the days ahead, all of us will need to draw upon this important tool of our tradition if we wish to emerge ready to rebuild our cities stronger and more resilient. Now, for better or for worse, the first half of the prophetic perspective has been foisted upon us by COVID-19. It's the half where we see the failings of our social structures. As systems shut down all around us, we, people of conscience, face down the terrible realities to which we had adjusted ourselves. I remember my moment. I was in my kitchen. I was pickling, because that's now something I do regularly for Central. And I was also listening to the news. And all around us, communities were closing schools. And yet New York City had not followed suit. And I didn't understand why. We suspected that young children were unknowingly bringing COVID-19 home to the most at risk. So why were we slow in shutting down schools? Then I learned something I surely knew in the back of my mind. That 30 million children in America rely on free or subsidized meals at school. 30 million. I was aware that food-insecure families could get access to nutrition at school. However, I never imagined the scale of it, or truly thought about the ethics of it. And suddenly I realized the absurdity of the situation. We could either close schools and starve children, or keep schools open and continue to spread this disease to vulnerable populations. And I became overwhelmed with fury and with shame, because that is not a choice we should have to face in America in 2020. That was the moment when I gained half of my prophetic perspective. I saw a deep structural failing of my community, one that I had accepted as normal, but was forced to see was anything but. How could a country of our wealth and resourcefulness and greatness have 30 million food-insecure children? And that was before the pandemic. The number is higher today. It's a fact that embarrasses me as an American and as a Jew. When some families during the lockdown could stock pantries and freezers full of food just in case, and other families wondered how they would feed their children without the school system, our normal is deeply abnormal. But perhaps you gained part of the prophetic perspective, that ability to see a societal failure, in a different moment. Perhaps it was when we turned our eyes to our healthcare system. We've been shocked by accounts of medical workers these past months. How could hospitals in the greatest city in the nation sound like medical tents in war-torn regions? Dr. Brendan Carr, chair of emergency medicine for Mount Sinai Health System, explained it this way. He said, "We essentially built a healthcare system with totally just-in-time supply chains because we value efficiency." He went on and said, "What just happened to us is we got caught out on that, and it became clear that we weren't ready for an unexpected bump in the night." But shouldn't we have been ready? We've known that allowing profitability to be the principal driver of our medical care creates fragilities within that system. We've seen it. We've seen it in the diminishment of primary care, in the chronic overcapacity of New York City hospitals, and in critical shortages of basic supplies and necessary medicines. And while these issues have impacted communities of color and the poor for decades, the clearest manifestation of this problem for all of us came during the pandemic, when we couldn't muster basic PPE for medical workers. We asked physicians and nurses to attend to pandemic patients without the proper means to protect them or their patients. We saw firsthand something that has been true to some degree for decades, but which COVID-19 laid bare. That penny-pinching measures baked into our healthcare system save dollars, but cost lives. And we're forced to ask, is that return on investment worthwhile? Dr. Carr continued to say that a return to business as usual would be unconscionable, but that change is unlikely to occur without large-scale reimbursement reform. When Judaism teaches that human life is invaluable, but our healthcare system demands that caring for life be as cheap as possible, our normal is abnormal. And I know from our conversations that many of you gained the first half of the prophetic perspective when we focused on employment. It became clear early on that the safest way to work was at home. And yet for thousands of our neighbors, this was just not possible. These workers were labeled essential. Most of them were low-wage workers. They had no real choice but to continue to face the danger of working on site so that they could eke out a living. And while we applauded them at 7 p.m. from the safety of our homes, these essential low-wage workers died or were exposed to this pandemic at a rate that was disproportionate with the general population. We gained our prophetic perspective when we realized that we labeled these people essential and then treated them as disposable. Physician and assistant professor of healthcare policy at Weill Cornell, Dr. Dhruv Kular, reflected, many of the people still getting infected are those who don't have the luxury of distance, those who by necessity or by trade expose themselves and their families to this virus every day. Many have paid with their health, some with their lives. When low-wage workers are forced to choose between a life-sustaining paycheck in life-threatening conditions or crippling poverty from the safety of home, our normal is abnormal. There were many similar moments that forced us to see absurd and terrible aspects of our society with which we learned to live. And our reactions ran the gamut: sadness, shame, anger, embarrassment. But we should not run from those feelings. Those are the mighty tools of the prophetic perspective, tools that we can put to work. We hear voices calling from every corner for us to reopen, start again, get back to business as usual. But we know that as we rebuild our city, the goal will have to be more than a return to that normal. We must assume the second half of the prophetic perspective, the conviction that we can overcome our past failings. The prophets, all of them spoke about restoring Jerusalem. But that didn't mean that they wanted to return to the way things were. Because before it was destroyed, Jerusalem was plagued with corrupt leaders and judges, widespread poverty, and the habitual abuse of the needy. That's not the Jerusalem the prophets wanted to build. They knew that reconstructing that Jerusalem would be a moral failure. Instead, the prophets took in all that had been broken, all of the past failings, and they envisioned a city guided by justice, where poverty was banished, where every soul lived with dignity. They provided the exiles a clear moral compass steering the way forward. Adopting the prophetic perspective, we can do the same in our time. We simply must ask ourselves where our society was failing, what about our city was a source of moral embarrassment, and who amongst our neighbors or the strangers amongst us were forced to live without dignity. And then we begin the hard work of rebuilding in light of our past mistakes. We seize the opportunity that has been thrust upon us. For while some prophesy the death of New York, others are getting their hands dirty, rebuilding their communities with prophetic perspective. Chefs like Gabrielle Hamilton and David Nayfeld are reimagining the restaurant industry. After seeing all of the old failures and having some time to take a break, they want to make dining more resilient and equitable for all of their employees, for all of their suppliers, and even for the patron. National organizations like the AARP and individual families who witnessed the devastation of COVID-19 to the system are now trying to reform elder care and nursing homes because they want to improve the lives of those who are aging and those who are attending to them. Even our youth are adopting the prophetic perspective. Teens from our community like Sydney Brown, Hannah Youngwood, Rachel Berman, Abby Berman, Lila Stevens, they've been speaking out about climate change. They've been adopting greener habits in their own lives because they've seen how inaction has led to devastation, and they're tired of seeing people do nothing. We can all choose one area where we want to disrupt the old system for the better. And remember, prophecy is already a part of you. The great sage Hillel said of the Jewish people, if we are not prophets, we're children of prophets. This is already inside our kishkas. So where will you choose to focus with an unflinching gaze and an unrelenting spirit? As we seek to emerge from our pandemic exile, we must restore our city using our prophetic perspective. For while others might be trying to get back to normal, our Jewish response is to rebuild our homes so that there is nothing normal about it. Embolden us, Adonai, to walk the streets with prophet's eyes. Let us not be crushed by the image of the city that lies before us. Let us not be trapped by narrow vision and rebuild the broken systems of yesterday. Let us transform our home into a new and unprecedented good, not only for ourselves, but for our neighbors and for the strangers as well. For on that day, as the prophet Isaiah wrote, this song will be sung in all of the land. Ours is a mighty city.